see certainly with this first attack of the disease, hysterical reactions of all kinds, lots of people blaming it on divine wrath or blaming it on very specific groups, immigrants, and the stigmatizing of certain immigrant groups.
We're in the middle of a raging pandemic, and by the looks of it, it's not going to end anytime soon. Billions of people, including you and I, are learning new ways to deal with the current pandemic and getting accustomed to changes in societal norms. But that being said, this is not the first time that we've faced one. Let's start with a little history on pandemics and how they spread back in the day compared to today.
Well, lots of different infectious diseases have developed into pandemics, and we can think of numerous examples of that. So plague, I think, is the most famous. It's the kind of referent that many people go to when a pandemic appears. The word plague almost has this generic quality to mean any particularly terrible, threatening, and catastrophic disease. Outbreaks of plague that have happened have occurred, from the ancient world through the medieval and early modern worlds and into the modern world. The third plague pandemic is the most recent one, beginning in China and spreading from Hong Kong in 1894, and certainly being most devastating in India, where it killed more than 12 million people. But other diseases too. So cholera, very famously, became a series of global pandemics in the 19th century, and that's continuing now. Yellow fever, and certainly influenza in various iterations, most famously the Spanish flu of 1918.
The rise in the number of pandemics in the 18th and 19th centuries led to devastating results that left millions dead. Our ancestors came up with a way to protect themselves from these outbreaks.
So it was in the wake of the Black Death, later in the 14th century, that quarantine first developed as a practice. In the port cities of Venice and what was then called Ragusa and is now Dubrovnik in Croatia. So quarantine, as distinguished from isolation, is about detaining people, or in this case, ships that could have been infected, but no one was clear whether they were or not. So anytime there was known to be a plague outbreak somewhere else, initially, these port cities said all ships coming from that region had to be quarantined, usually on an outlying island off the coast, for a period of days. And it was 40 days initially, and that's how we get the word. It comes from the Italian word quaranta for 40.
Even with quarantines in place, society back then could not stop the spread of a disease.
People were terrified of hospitals. Hospitals, they certainly weren't run by the government, or in most cases. Hospitals were often charitable institutions, and often people had a sense that you only went there to die. There are travel narratives where people describe being in Istanbul during a plague epidemic and people having this terror of being sent to the plague hospital because they identified it with death.
We've come a long way since then, but there is one similarity that remains between our societies and the societies of the past, and that is the stigma related to the outbreak.
Well, you see it taking quite a long time for people to figure out what these new diseases even were. And you see certainly with this first attack of the disease, hysterical reactions of all kinds, lots of people blaming it on divine wrath or blaming it on very specific groups, immigrants, and the stigmatizing of certain immigrant groups. So in many cases, COVID-19, for example, started by afflicting relatively affluent people, people who are traveling. As these diseases move through societies, and this happens now and it happened in the past, you see the kind of relative impact on social groups shift. And as they get entrenched in cities, certainly come to afflict at much higher rates poorer people, those who live in neighborhoods with hospitals that are not as well stocked, those who don't have jobs that are easily shifted online. And I think that certainly was the case with cholera and plague, that the impact was invariably worse for poorer people and for many minority communities. And that seems to be playing out now with COVID-19 too.
While there may not be a handbook that we can refer to, there definitely exist patterns that we see in our society that have looped on from various other pandemics. We on our part need to learn from this ongoing crisis and ensure that we leave our future generations with better chances of dealing with the next one.